Good day, students. Myself, Dr. Harish Kumar Singhal, Assistant Professor, PG Department of Commerce, Dr. सर्वपल्ली राधाकृष्ण राजस्थान आयुर्वेद विश्वविद्यालय। पिछले लेक्चर में हम लोगों ने देखा स्कंदपस्मार ग्रह के क्या लक्षण होते हैं। आचार्य सुश्रुत और आचार्य वाग्भट ने किस प्रकार से स्कंदपस्मार ग्रह को बताया है और क्या उसकी चिकित्सा बताई है। इस लेक्चर में हम देखेंगे या सीखेंगे कि स्कंदपस्मार ग्रह को आचार्य सुश्रुत और आचार्य वाग्भट के द्वारा बताए गए सिम्टम्स के आधार पर कन्वर्जन के समान माना गया है। अब यह कन्वर्जन क्या होता है, किस तरीके से शिशु के अंदर देखने के लिए मिलता है। A seizures or the convulsion is a paroxysmal, time-limited change in the motor activity and behavior that result from the abnormal electrical activity in the brain. Seizures are commonly seen in the pediatric age group and occurs in approximately 10% of the children. Most seizures in children are provoked by the somatic disorders originating outside the brain, such as high fever, infection, syncope, head trauma, hypoxia, toxins, or the cardiac arrhythmias. Other events such as breath-holding spasms and gastroesophageal reflexes can cause events that stimulate the seizures. A few children also exhibit psychogenic seizures of the psychiatric origins. Epilepsy, seizures, and convulsions. These are very closely terms. Epilepsy और सीजर्स में हम कैसे डिफरेंस करेंगे। सीजर्स क्या है? व्हेन नर्व सेल इन द ब्रेन फायर्स इलेक्ट्रिक इंपल्सेस एट ए रेट ऑफ द अप टू 4 times हायर देन द नॉर्मल, देन कॉज ए शॉर्ट ऑफ द इलेक्ट्रिक स्ट्रॉम इन द ब्रेन नॉन एज सीजर्स। सीजर क्या है? यदि ब्रेन के अंदर नर्व सेल्स अपने नॉर्मल गति से 4 गुना गति से विद्युत आवेग को फायर करती हैं, तो वहां पर एक तूफान सा आ जाता है जिसे हम सीजर्स के नाम से जानते हैं। ए पैटर्न ऑफ द रिपीटेड सीजर्स इज नॉन एज एपिलेप्सी। यदि इसका रिपीटेशन बार बार हो तो उसे हम एपिलेप्सी के नाम से जानते हैं। जबकि कन्वर्जेंस के अंदर क्या डिफरेंस होता है कि कन्वर्जेंस violent irregular motion of the limbs or the body caused by involuntary contraction of the muscles arise from the motor cortex. जब इनके साथ में irregular motion of the limbs or body by involuntary contraction of the muscles के अनैच्छिक contractions हो और साथ ही हाथ और पैरों के अंदर भी contractions दिखाई दे या motion दिखाई दे, तो हम उसे कन्वर्जन के नाम से जानते हैं। तो सीजर्स, एपिलेप्सी और कन्वर्जेंस में डिफरेंस हमें देख सकते हैं कि किस प्रकार हम उनको डिफरेंशिएट कर सकते हैं। सीजर्स इन चिल्ड्रन occurs when brain functions abnormal, resulting in a change in movement, attention, or level of the awareness. Different types of seizures may occur in different part of the brain and may be localized or widespread. Seizures may occur for many regions, especially in children. Seizures in newborns may be very different than seizures in toddlers, school-age children, and adolescents. Cause of seizures in children are many. In many cases, there is family history of seizures. Other regions of the seizures are infections, metabolic disorders, drugs, medication intake, poison, disordered blood vessels, bleeding inside the brain, and idiopathic causes. Seizures are divided into the two parts: partial or the generalized seizures. Partial seizures, only a part of the brain is affected, while the generalized seizures, all the cortex is disturbed. Partial seizures is divided into the two parts: simple and complex. Simple seizures may be divided into the 3: motor seizures, sensory seizures, autonomic seizures, and psychic seizures. And general seizures divided into the 5 types: tonic-clonic seizures, absence seizures, myoclonic seizures, atonic seizures, clonic seizures, and tonic seizures. Generalized seizures are described as granulomatous epilepsy or the generalized tonic-clonic seizures, that is GTCS seizures. In such seizures, we can see unconsciousness, convulsions, and the muscle rigidity. Absence seizures is also known as pycnolepsy. In these seizures, we can see brief loss of the consciousness. Myoclonic seizures is sporadic or the isolated. Jerking movements are seen in the seizures. Clonic seizures is repetitive and jerking movements are seen. Tonic seizures are muscle stiffness, rigidity. In atonic seizures, loss of muscle tones are seen. We can see a tonic seizures and the clonic seizures. Partial seizures is divided into three parts: simple partial seizures, complex partial seizures, and partial seizures with secondary generalization. Simple seizures, again divided into three, is of three types: simple motor, simple sensory, and simple psychological. Simple motor seizures are characterized as jerking, muscle rigidity, spasm, and head turning. A simple sensory, unusual sensation affecting either the vision, hearing, smell, taste, or touch. While the simple psychological seizures are characterized by memory or the emotional disturbances, complex seizures are characterized by automatism such as lip smacking, chewing, fidgeting, walking, and other repetitive involuntary movements. But the movements are coordinated. Partial seizures with secondary generalization, its symptoms are initially associated with preservation of the consciousness that then evolves into a loss of the consciousness and the convulsions. The seizures occurs when a child contracts as illness such as ear infections, cold, or the chickenpox, accompanied by the fevers. Is the most common type of the seizures in children. Children with the relatives, especially brothers and sisters, who had febrile seizures are more likely to have a similar episode. Children who are developmentally delayed are more likely to have a febrile seizure. Children who have had a febrile seizures in the past are also likely to have a second episode. What is febrile seizures? Most common seizures during childhood period. It is defined as convulsions occurs with the fever in a neurodevelopmental normal child in absence of confirmed or the suspected CNS infections. The most common age is 6 months to the 5 years of age. Peak incidence is at 14 to 18 months of the age. Incidence is 3 to 4%. Febrile seizures are of two types: simple febrile seizures and the complex febrile seizures. Simple febrile seizures are characterized as generalized seizures, while the complex febrile seizures are characterized as focal seizures or the focal onset. Seizures duration is short, usually less than 5 minutes, while the complex febrile seizures duration is prolonged, usually more than 15 minutes. Simple febrile seizures usually not occurs in series or the repeated in the same illness, while the complex febrile seizures occurs in series or repeated in the same illness. Simple febrile seizures में हम देखेंगे no temporary or the permanent neurological deficit occurs after the seizures, while it occurs in the complex seizures. Postictal phase usually absent in the simple febrile seizures, while the postictal phase of the drowsiness or the impaired level of the consciousness is seen in complex febrile seizures. Simple febrile seizures is not associated with the brain damage or the subsequent intellectual problems, while complex febrile seizures having associated with brain damage or subsequent intellectual problems. Chance of developing later epilepsy is very rare in case of the simple febrile seizures, while complex febrile seizures के अंदर epilepsy डेवलप होने के चांसेस बहुत ज़्यादा होते हैं. Neonatal seizures occur within 28 days of the birth, which is most common after the child is born. There may be due to a large variety of the conditions. It may be difficult to determine if a newborn is actually seizing. because they often do not have convergence. Instead, their eyes appears to be looking in a different directions. They may have lip smacking or the period of the no breathing. Seizures in the newborn. Partial seizure with or without generalization seizure, which occurs in the first month of the life. It occurs in 6 per 1000 live birth. Causes: birth injury, calcium and glucose intolerance, metabolic disorders, congenital malformations, and infections. These seizures can be substral, tonic extensor, myoclonic, clonic, and apneic. Infantile spasm is characterized by brief symmetrical contraction of the neck, trunk, and extremities, always associated with the severe mental retardation, and seizures disappear by the 5 years of age. The causes: birth injury, asphyxia, developmental disorders, brain infections, metabolic disorders, and pertussis vexis. It is 3 of types: flexor, extensor, and the mixed. In the flexors, it occurs in clusters and volleys and consists of sudden flexion of the neck, arms, and the leg, then spread to the trunk. Extensors produce extension of the trunk and the extremities and are the least common type of the infantile spasm. Mixed infantile spasm consists of the flexion in some volleys and extension in others. It is the most common type of the infantile spasm. Then we can see the evolution of the first seizures. Evolution: infant and the child during or shortly after the suspected seizures should be include an assessment of the adequacy of the airways, ventilation, and cardiac functions, as well as the measurement of the temperature, blood pressure, and the glucose concentration. For acute evolution of the first seizures, the physician should search for the potential life-threatening cause of the seizure, such as meningitis, systemic sepsis, accidental and the non-accidental head trauma, and ingestion of the drugs, abuse, and other toxins. Detailed history to define factors that promoted the convergence and the detailed description of the seizures and the child post-ictal state also. The Rolandic epilepsy, it is a benign syndrome which appears as simple partial seizures with the symptoms of originating in the mouth and throat. Neurogenic brain lesions start between the 4 to 10 years of age, 21 per lakh. Incidence is seen: strange feeling in throat and tongues, salivation, choking sensation, teeth grinding, difficulty in speaking occurs at night. Now, what are the investigations are needed during epilepsy? X-ray, chest scan, CT scan of the head, MRI of the head, or EEG. The treatment during an attack of an epilepsy: turn the child to the side, keep head low positions, remove cloth, cover with a plain blanket, lukewarm water, sponging, put fan to facilitate evaporation, diazepam IV 0.3 mg per body weight, phenytoin IV 10 to 20 mg body weight at a rate of 1 mg per minute, given immediately after the diazepam. After control of the convulsion, oral phenytoin 5 to 8 mg per kg per day into divided doses, or the phenobarbital intravenous 15 to 20 mg per body weight, followed by the oral phenobarbital 3 to 5 mg per kg per day. If seizures are not controlled by our method, then IV diazepam 10 mg per body weight per hour. General anesthesia or phenobarbital with the ventilations. Rectum sodium valproate 20 mg per body weight can be given. The commonly used drugs, a table is given here. We can see carbamazepine, clonazepam, ethosuximide, gabapentin, nitrazepam, phenobarbital, phenytoin are given here with their indications, with their dose, and what are the side effects. Prevention: most seizures cannot be prevented. There are some exceptions, but these are very difficult to control, such as head trauma, infections during the pregnancy. Children who are known to have febrile seizures should have their fever well controlled when sick. The biggest impact caretakers can have is to prevent further injury. If a seizure does occur, the child can participate in most activities just as other children do. Parents and other caretakers must be aware of the added safety measures, such as having an adult around the child. One common area for added caution is in the bathrooms. Showers are preferred because they reduce the risk of drowning.